I'm HIV positive and I was homeless. I was living in the street, going from shelter to shelter, not really in care. The doctor gave me my prescription and I went across the street to fill it and there was an issue with it. So I called Harlem United and within 15 minutes, I got my medication.
The 340B program, which is a federal drug discount program, it provides community-based providers and community healthcare clinics like Helen Lord reliable funding to address health inequities in under-resourced communities.
When someone is homeless, it helps them to be housed. If someone is hungry, it helps them to be fed. If someone's viral load is high, it helps to suppress the viral load, and it helps them to be healthy.
We have patients that come in that are not receiving just primary care or just behavioral health. They're receiving a wide range of services, whether that is care coordination, transportation, dental services, nutrition, housing, you name it. We're trying to better understand the needs of that person and address those the best we can.
Right now, Governor Kathy Hochul is considering a proposal to carve out the pharmacy benefit from Medicaid managed care, which would cause irreparable harm to New York's most vulnerable communities.
So much is at stake for community health centers if 340B were to go away. Over 50 health centers would likely have to close sites or reduce their service hours. Community health centers would not be able to provide the supports that they do now to ensure that the patients can use their services.
We use 340B funds not only to take care of 1,200 students, but we also use it to help some of the most vulnerable amongst us. Up to 10,000 people that we work with don't have insurance here in Nassau County. We use this to provide medication and programming for those folks using 340B dollars, exactly what the program is designed for.
It's painful to think of cutting services to people in need, especially in periods of rising inflation. It really pains me that with the stroke of a pen, this could be reversed.
Clients we serve traditionally have difficulty accessing primary health and mental health care. Any disruption in those services would result in higher emergency room visits, higher hospitalizations, and increased costs to the state.
And I will tell you, without these services, people fall through the cracks. People's viral loads are not suppressed. Without these services, very often people are alone and trying to navigate the system on their own. And so it's imperative to have someone help them to navigate through the system to make sure that all their needs are met so that they can remain healthy.
Imagine me, as a woman of trans experience, HIV positive, having to wait 4 to 5 days to receive her medication. That'll actually ultimately end up putting me into a bracket where I'm no longer virally suppressed.
Mine was a lucky story. I was able to get that help, but not everybody will be able to get that kind of help. So what happens to them? What happens to the person who has a mental health issue and they're trying to get medication and they can't? Who are they going to call to help them?
Governor Hochul, on behalf of our community health workers, the safety net population we serve, the LGBTQI individuals, communities of color, substance users, we're asking that you reverse course on this 340B carve-out.
Governor Hochul.
Governor Hochul.
Governor Hochul.
Please repeal the Medicaid pharmacy carve-out.